Welcome back, my people. Imodium dosage in adults and children. Previously, or in our previous video, we started discussing about Imodium, or in other words, loperamide, which is the active ingredient of Imodium, a drug which is commonly used to stop diarrhea symptoms. And before we continue, guys, I always appreciate your support, the subscriptions, the likes, the comments, and everything you are doing to support this channel. If you are subscribing, you are liking, you are commenting, you are playing part in development or growth of this channel. So feel appreciated. And for those who have not subscribed, let's consider doing so. And after you subscribe, make sure you put the notification bell on so that whenever I upload any video, YouTube will automatically notify you and you will never be left behind. So let's look at Imodium dosage in adults and children 12 years or older. Imodium dosage in adults and children 12 years or older. The recommended dose is 4 millimeters start, or 4 milligrams, 4 milligrams to start with, followed by, get this very clearly, 4 milligrams to start with, followed by 2 milligrams for each loose stool. Or you start by 4 milligrams, then followed by 2 milligrams after every loose motion, after every loose stool that occurs after that. 4 milligrams to start with, followed by 2 milligrams after every loose motion or every loose stool that occurs after that. A point to note, don't take more than 8 milligrams per day. Don't take more than 8 milligrams per day because it may harden the stool. It will slow down the bowel movement. Make sure that the intestine absorb a lot of water, and this will make the stool more dry than it should be. Let's look at the dosages for children younger than 12 years. Children younger than 12 years. The dosage should be based on weight or age. The dosage should be based on weight or age. Children 60 to 95 pounds. Children 60 to 95 pounds. All aged between 9 to 11 years should take 2 milligrams to start with, then 1 milligram after every loose motion or stool occurring after that. Don't exceed 6 milligrams. So children 9 to 11 years or children 60 to 95 pounds of weight should take 2 milligrams to start with, then 1 milligram after every loose motion or stool occurring after that. Don't exceed 6 milligrams per day. Let's look at the dosage for children who are 48 to 59 pounds or 6 to 8 years. 48 to 59 pounds or 6 to 8 years. These should take 2 milligrams to start with, 2 milligrams to start with, then 1 milligram after each loose stool that occurs. 2 milligrams to start with, then 1 milligram after each loose stool that occurs after that. Don't take more than 4 milligrams per day. Don't give these children more than 4 milligrams per day. Let's look at the dosage for children aged between 2 to 5 years and weighing 29 to 47 pounds. Weighing 29 to 47 pounds and 2 to 5 years old. Use Imodium only on the advice of a pediatrician or your doctor. For children 29 to 47 pounds or 2 to 5 years, use Imodium only on the advice of your doctor or pediatrician. Children under 2 years, do not give Imodium to children younger than 2 years of age. So it's contraindicated. Imodium is contraindicated or should not be given to children under 2 years of age. A question to ask: what to avoid while taking Imodium? What should you avoid while taking Imodium? Because maybe there might be drug interactions or adverse effects. So what should you avoid while taking Imodium? Some people experience drowsiness after taking Imodium. If you are taking Imodium for the first time, avoid potentially risk activities, for example, driving until you know how your body will react. Some people experience drowsiness after taking Imodium. So if you are taking Imodium for the first time, avoid potentially risk activities, for example, during driving until you know how your body reacts to Imodium. Avoid alcohol when taking Imodium, as it may increase risk of some side effects such as dizziness and fatigue. Avoid alcohol when taking Imodium, as it may increase the risk of some side effects such as dizziness and fatigue. So when you are drunkard or when you are drunk, you should not take Imodium. Certain foods and drinks may worsen diarrhea and related symptoms. Certain foods and drinks may worsen diarrhea and related symptoms. So avoid caffeine or caffeinated drinks, dairy products, spicy foods, fatty foods, fried or high fiber diet till your bowel has returned to normal. Certain foods and drinks may worsen diarrhea and related symptoms. So avoid caffeine, dairy products, spicy foods, fatty foods, fried or high fiber diet till your bowel has returned to normal. A question to ask, or a question we should ask ourselves: does Imodium have side effects? Does loperamide have side effects? And the way most of the people love this drug, even the old generation, the nyanyas and at home know about loperamide. Does it have any side effects or any adverse effects to our body or our systems? Its Imodium is well tolerated by many people. That means to a greater percentage it's well tolerated and it doesn't cause any adverse effects or any side effects. So it's well tolerated by many people. However, it can sometimes cause side effects. Imodium is well tolerated by many people. However, it can sometimes cause side effects. For example, constipation, dizziness, tiredness, headache, nausea, vomiting, dry mouth, and it has also serious side effects. So, some of the side effects which might be mild as a result of use of Imodium are constipation, dizziness, tiredness, headache, nausea, vomiting, and dry mouth. Serious side effects which needs medical attention include the following: bloody or worsening diarrhea, severe dizziness, fainting, swelling or pain in abdomen, painful peeing or urination and blistering skin, Signs of allergic reaction, for example, skin rash, wheezing, swelling lips and tongue. These are the side effects associated with the Imodium. The mild side effects include constipation, dizziness, tiredness, headache, nausea, vomiting, dry mouth, and dry mouth. Whereas the serious side effects which needs medical attention include blood or worsening diarrhea, severe dizziness, fainting, swelling of the abdomen, painful peeing or urination or blistering skin, signs of allergic reaction, for example, skin rash, wheezing, swelling lips and tongue. This marks the end of our discussion about Imodium, and I hope we have all understood this drug we commonly use at home, which is an over-the-counter drug, meaning it doesn't need any prescription for you to buy it. So before you take it, I hope you have understood the side effects associated, the mode of action, or how it reacts on your systems to control diarrhea. So let's continue subscribing, liking and sharing with our relatives, our haters and lovers, and make this channel grow to greater heights. So let's have a good evening and meet in our next session tomorrow. Have a good evening.